Good day. In this video, we'll talk about the causes and risk factors associated with the Paget's disease of the breast. Now, doctors don't actually know what causes Paget's disease of the breast, and the most commonly accepted theory is that the disease results from an underlying ductal breast cancer. The cancer cells from the original tumor then travels through the milk ducts to the nipple and its surrounding skin. Another theory is that the disease can develop independently in the nipple itself. The risk factors. The risk factors that affect your likelihood of developing Paget's disease of the breast are the same factors that affect your risk of developing any other kind of breast cancer. Some factors that make you more susceptible to the cancer include the increasing age. The risk of breast cancer increases as you age. A personal history of breast conditions. If you had breast biopsy and found lobular carcinomas in situ, LCIS, or atypical hyperplasia of the breast, you have an increased risk of breast cancer. A personal history of breast cancer. If you had breast cancer in one breast, you have an increased likelihood of developing cancer in the other breast as well. A family history of breast cancer. If your parent, sibling, or child was diagnosed with breast cancer, particularly at a young age, your risk of developing breast cancer is increased. Still, the majority of people diagnosed with breast cancer have no family history of the disease. Inherited genes that increase cancer risk. Certain gene mutations that increase the risk of breast cancer can be passed from parent to child. The most well-known gene mutations are referred to as BRCA1 and BRCA2. These genes can greatly increase your risk of having breast cancer and other cancers, but they don't make cancer inevitable. Radiation exposure. If you receive radiation treatment to your chest as a child or a young adult, your risk of developing breast cancer is increased. Obesity. Being obese increases your risk of breast cancer as well. Beginning your period at a younger age. Beginning your period before the age of 12 increases your risk of breast cancer. Beginning menopause at an older age. If you begin menopause at an older age, you're more likely to develop breast cancer as well. Having your first child at an older age. If you give birth to your first child after the age of 30, you may have an increased risk of developing breast cancer. Having never been pregnant. If you've never been pregnant, your risk of breast cancer may be increased. Postmenopausal hormone therapy. Hormone therapy medications that combine estrogen and progesterone to treat signs and symptoms of menopause may increase the risk of breast cancer. The risk of developing disease, the risk decreases when you stop taking these medications. However, drinking alcohol. Drinking alcohol increases the risk of breast cancer. That concludes this video. In the next video, we'll talk about the prevention of this disease. Thank you.